Hi, good morning. This is Coffee with Stacey. Just wanted to spend some time with you guys. It feels like it's been a long time, but I know that's not true. It has been just 2 weeks, right? And 2 weeks ago, we had an amazing conversation with some Black men about what was happening with the protests. I thought that was absolutely, a really beautiful conversation. Good morning, Mike McQuarrie. Um, and, we were able to have a discussion about their experiences with police, with systemic racism, what they think next for this country. He didn't talk much, but Dr. Gregory Parks, who was also in the conversation, really shared a lot of work that he's been doing. Good morning, Ms. Hodge. How are you? Good morning, Leona. Good to see you as well. It's good to see people on Facebook who are participating. So that was an amazing discussion in my estimation. And I would ask you guys to go back and look at that. The reflections were of young Black men in this country during this time. In Congress, this has been a really, really busy week. I am very tired right now. I don't know if I look it, if I've been trying to kind of cover it with some makeup this morning, but I'm very tired. We had discussions about police brutality. The Democratic caucus rolled out a bill on systemic racism. And there's been debates and discussions about that and how that is going to, how it's going to be utilized in this country. Just to give you guys some highlights. I had a conversation and led a conversation with members of the Black Caucus with the FBI. The director of the FBI, Chris Wray, used to be my boss. We both worked for Larry Thompson, who was the Deputy Attorney General. I was the senior counsel, and Chris Wray was the chief of staff. And we maintained a cordial friendship. I've admired him for his, he's kind of like a Robert Mueller, just head down, do your work. Don't get distracted by the politics of what's happening around you. And he offered to have a conversation with members of the Black Caucus about what his office was doing, what his thoughts were. I was really moved that he called the protests a righteous protest, that he thought that it was important that people are out in the streets. And so, good morning, Mr. James, watching from Long Island. Morning. Elise Cosnard, Colas, I know that's your last name now. It's so good to see you. Are you watching from France? Are you all the way? Elisa and I went to high school together, and it says that she's watching. That's the amazing thing about this social medium that we're able to utilize. So one of the things he discussed in that conversation with us was that the police, there is a national database where police departments can give information about allegations of misconduct, police brutality, complaints, community complaints. And the FBI compiles that data to find out what trends are, to make recommendations, to offer training. Only 40% of police departments in the United States utilize that on a voluntary basis. So one of the major requests that he had, and that was put in the bill, was that it be made mandatory for police departments to do this. This way, there is a database. It will not share personal data with the public, but the FBI and other police departments will be able to see if an individual has had allegations of misconduct in the past and is attempting to move into another area. There were also, in the bill, are a lot of components for enhancement of police departments, de-escalation, increased community outreach. There was a change to, and for my lawyers out there, change to what is required, the mental state of mind in a case against a police officer, to change from willful to reckless, because the degree that is needed of evidence to show that someone's mind was willful is very different than someone who has been trained and has standards and is acting recklessly. So that was another request. And I'd invite everybody to go to our Facebook page, to plaskett.house.gov. That's my official website, or to Congresswoman Stacey Plaskett on Facebook, and you can get more information about the bill there. But the thing that really had me tired this week is I'm on the Transportation and Infrastructure Committee, and we had a markup of the Transportation and Infrastructure Bill, which it took us 2 days in a hearing to do the bill, 2 days in a hearing to do the bill. We started at 10 a.m. and we were lucky. Most nights we got out at 11:30, but it was debating each amendment, hundreds of amendments, and discussion and arguing and debating and offering amendments, withdrawing amendments, working behind the scenes. I'm going to give a shout out to Jeff Noel. Jeff is my legislative director. Of course, we bonded in those late night hours, working really hard to make sure that the Virgin Islands got its fair share. And we're going to be announcing what that was, what we received, because it was pretty phenomenal. So that was my week. And then I actually got to go to Black Lives Matter Plaza. I took my daughter Talia down yesterday on Juneteenth, which we have all, now that the president has told us, we all know so much more about what what Juneteenth is. So we went down to the plaza. Talia, as some of you may know, is a hypochondriac, so just like our dad. So she did not want to be around crowds, with the COVID, but we really tried to skirt people as we were walking through the plaza. I felt her. I've never been that close to her. She kept pressing herself against me as we were going through. It was really a great time. I see that Harold is watching. Harold is Jerry Garcia's Swedish dad, and he's watching from Sweden. Harold, we miss you on St. Croix. You haven't been home in a while, but much love to you goes out to you. So we have some guests, and I think that's going to be a really amazing discussion. The guests that are with us today are some individuals who are going to speak from different perspectives about the coronavirus, about COVID-19. We have Con Davis, who lives on St. Thomas, and Con has been very vocal and outspoken about his own experience with the coronavirus and what he's done to overcome that, to get through it, offering advice to others as well. And then we have Dr. Bert Peterson. Dr. Peterson is from St. Thomas, and he lives in New York, and he is on the front line at hospitals in New York City, fighting the virus as well and keeping people safe. So thank those guys for being there. And then we have our own Dr. Ellis. Dr. Esther Ellis is the superhero warrior who is our doctor at the Department of Health in the Virgin Islands, giving all the information, fighting for us as well. Oh, wait, I just saw that Richard Mota is watching. Richard, I just want to give you a personal shout out. Blessings to you and your family, to Amani. You just had a baby girl. I know you have a baby girl and you just had a baby boy. Blessings to you both. We're so happy for the increase in your blessings in your family this past couple of weeks. And with us, oh my gosh, I didn't know the commissioner was able to hop on. I know she was on, so has a lot going on. So Commissioner Encarnacion with the Department of Health is also with us this morning. So thank you guys. You guys are the experts on this. So I thought we would start with Dr. Bert, who has been out there on the front lines, working in New York City. So Dr. Bert, can you tell us about your experience?
Well,
You got to introduce yourself, give your background,
oh, sure, sure,
and
sure.
then
So
talk about that.
for the people I'm Dr. Bert Peterson. I am a native Virgin Islander. I was born on St. Thomas, did all of my primary, secondary school education, public school system. Shout out to the public schools. Graduated from the Lurican High School. And I did my college and medical school training at Johns Hopkins University, Johns Hopkins School of Medicine, trained in general surgery at George Washington University Medical Center in Washington, D.C., and then moved to New York and trained in surgical oncology at Memorial Sloan Kettering, and I've remained in New York ever since. So as you heard, I'm a cancer surgeon, not someone that you would routinely think would be on the front lines, but
Mm-hmm.
so everyone knows New York, the degree to which New York got hit. New York clearly was the epicenter of the pandemic for the United States. But I practice in the Bronx at a hospital called named St. Barnabas Hospital. And if you look at the breakdown of the numbers in New York, of the 5 boroughs of New York City, the Bronx far exceeded the other boroughs of New York. So the Bronx was the epicenter of the epicenter. And then when you break it down by zip code, the zip code of my hospital and the surrounding community surrounding my hospital was the hardest hit. So we were the epicenter of the epicenter of the epicenter. And I too got sick with the virus very early on. I was one of the first people to get sick. And a lot of it had to do with the fact that when we were first told about this, it was all the hand washing stuff. And no one actually realized the degree to which wearing face masks were going to make a difference. And luckily, our chief of infectious disease realized that the rate at which the employees were getting sick, that it was at an alarming rate and we had to do something different. And she instituted mandatory face masks long before everybody else did. And we saw our numbers for employees start to come down way before the rate of patients coming in.
So, Dr. Bert, before that, how were people, so if patients would come in and you would just be talking with them and you didn't have the face mask on initially?
Yeah, because you would be seeing patients in the clinic without a face mask, but everyone was washing hands and hand sanitizer. There was just a lot of that. Clearly, when we went to the floor, people would put on face masks. When I go to the OR, I had on a face mask, but in the clinic, it wasn't happening. And in fact, the person who I got infected from was an employee who came to the clinic as a patient, but didn't tell us he was a patient. And then he got sick about 4 days after I spoke to him. 4 days after that, I got sick. And then I got my mother sick as well. She's 81. And this was the whole process. We were just transmitting the virus without realizing that we all needed face masks. And so that was that. And pretty much I was out. But for healthcare employees, we only got once our fever broke, we had 3 days to come back to work.
Wow.
We had 72 hours. So I was only off for a week and had to report back to work. But while I was out, I retrained and brushed up on my critical care skills, took the tests that I needed to take. And I came back and then I started, our hospital normally runs about 16 ventilators. And at our peak, we had 105. We had no new doctors, no new nurses, no new respiratory therapists. So the departments of medicine, surgery, and anesthesia combined, and we opened 5 ICU units. Normally an ICU would have 1 patient per room. We had 2 patients per room. We had 1 ICU nurse for each unit because we didn't have enough nurses. And I was running one of the units for about 6 or 7 months. So I pretty much went back to working like a resident. I worked 6 days a week, including 24-hour in-house call. But I have to say it was pretty, amazing how we pulled together in the Bronx to, take care of our patients who also, because of the higher rates of comorbid illnesses, hypertension, diabetes, heart disease, and so on and so forth, didn't fare as well with the virus. You know what I'm saying? We definitely saw the disparities in
people were saying that, looking at some of the statistics, that they believe places like the Bronx, and the Bronx in particular, had such a high infection rate because so many of the people that live there are still essential workers.
Yeah.
You know, that those are individuals who are out there working on trains, working in the
Yeah.
areas that could not close.
That's right. So we had all the MTA employees that were dying. You're right. There are a lot of essential workers, densely populated, living in, cramped spaces. And then in addition to that, the comorbid illnesses actually contributed to it. So for example, the kinds of pneumonias we saw in the Bronx were very different. Other people were dealing with super infections with bacteria, but our patients had fungal pneumonias with bizarre strains of Candida. We had pneumonias with mold. So it was just not what you would typically see. And then the number of young people that were coming in and all, people think this is just a disease of the elderly, but we had a lot of young people, like the 28-year-old pregnant young woman who died, or the 19-year-old who pregnant and died also, so there were lots of it was very tragic for us, the healthcare workers, too, to deal with taking care of people who you never had a chance to actually even speak to, because they came in most of the times already in respiratory arrest. You met them already intubated. The families never came in. And so you were there as their only advocate, fighting on their behalf without their friends and loved ones around them. And oftentimes, the only contact you had with the family was at that moment when you had to say it didn't go well, And as a physician who's been in practice for 26 years now, I think, I had never signed a death.
Showing your age, Bert.
I know. I just turned 58 2 weeks ago. I had never signed a death certificate in my entire practice in medicine. And I remember the first time they brought one during this pandemic. It just was jarring for me emotionally that I was actually signing a death certificate. I had never done that, and it was pretty intense,
And you ended up signing quite a few.
Yes. Yeah.
How are you doing emotionally now from all of that?
I'm doing better. There were moments when I would go into work and it was hard to get out of the car because there was such a sense of dread and gloom throughout the Bronx in particular. You just and it like I said, for me the hardest part was having to take care of people who I'm their only contact, and they're not even seeing me. It's a mask, a face shield. They were just basically getting a view like this, just the eyes, and so it was
not make human contact with them, there's no,
yeah, and dealing with my own illness at the time and with my mother, it was just a lot going on, and I've missed human contact myself, so that was pretty intense.
People don't know that Dr. Bert Peterson is this amazing doctor in New York, but he's also the primary fetter during Carnival in St. Thomas.
That's right.
So when he says he needs human contact, you don't even know the beginnings of it.
I have to tell you, this is going to be so bad, but when I knew the pandemic was coming, I was like, I wonder if it'll be over by Carnival. I wonder if that was like one of my biggest concerns. I'm like, please let this thing go away so we could have Carnival, and that was
Commissioner Encarnacion was the person who made sure that we did not have Carnival.
I know.
And made sure that we did not have what New Orleans had by going ahead and having Mardi Gras and then having that tremendous bump in infections. So, Commissioner, how are you and your staff doing? And what are the things that you want to share with us this morning?
Well, first, good morning, everyone. I first want to thank Dr. Peterson for what he said. It meant a lot. The first words that came out of his mouth is that they did not realize the impact of wearing a mask. And so that a little later, but I really wanted to thank him for everything he said and what he's done and what he's gone through. That can teach us quite a bit. I think our staff, we're doing well. I think we have a very strong team. Dr. Ellis has joined since the pandemic. We've pulled her into our executive team, so she's there for many of the discussions as well. But we try to take care of our own. And so we've had several meetings where it's just let's talk. Let's just speak to each other and see how we're doing. We're making sure that our staff in itself are taking time out. So we're partnering up everyone. Dr. Ellis had her time off last week, and so I'm sure she'll be taking a few days off coming shortly as well. But I do have some numbers if you'd like me to relate the most current numbers for you in the VI. That would be good. So thus far, we've tested a total of 2,586 persons under investigation. Those have tested negative is 2,492, tested positive 74. But we still have about 20 pending tests that's going to actually occur today. We have 4 active cases. 2 of them are community related, and recovered 64. And we've had 6 fatalities, which for a small territory, it doesn't. It to us, it's a lot. Yeah. And so that's why we've worked so hard in ensuring the mitigation efforts are put in place. We have a very cohesive emergency operations center that we work with daily. And so we look, what are the tasks for the day? What do we need to do? Let's get it done. At the end of the day, we have a report out. So we know, and we pull agencies in. So I have to say that one of the things that I think we've been successful with is in January, we pulled all the agencies that we thought would affect us in any way. By TEMA, of course, being the other lead agency for the pandemic. And we pull in any ports that we can possibly see of entry, because look at what we're speaking about. Most of our individuals have come to us with COVID or developed COVID upon arrival. So travel related is our highest incident at this point in time. So we need to protect ourselves. Here, we've opened up. You know that we've opened up a little bit. We've seen where our numbers are bumped. We bumped up a little bit as a result that we're up to 74. But how do we now protect ourselves? Right. There's always a balance between finances and health. Health is president always has, and the governor makes that aware to everyone. And of course, my team and I, Dr. Ellis and Dr. Sims, my assistant commissioner, are on the phone with him every morning with all the healthcare providers as well as other agencies to really vet the process. And he's very open-minded as to where we need to go.
Thank you. I think maybe we want to bring both you and Dr. Ellis on at the same time. Commissioner, I just want you to know, Randall James said good morning to you.
Good morning.
He wanted to say howdy to you. And Ms. Jarvis, thanks so much for listening and keeping up. I wanted to ask you, you said, we have now a couple of community transmissions. Does that concern you? And what are you doing to contain that? If you can share with people so that they have some, people don't kind of panic when they hear that.
To answer your question, of course, yes, it concerns all of us. And what we're doing about it is 2 things, well, a few things, but the major thing is re-educating the public what they need to do to protect themselves. The main thing is, of course, wearing the facial coverings as well as hand hygiene. The second thing I'm going to actually have Dr. Ellis speak to, and that is what we're doing in terms of contact tracing. And what we've really had some successful work done by her team. We've actually brought some more team as members as well. Dr. Ellis, can you take that one?
Yeah, good morning. Thank you for the
opportunity
to have coffee with you this morning.
Do you have coffee or tea?
I have coffee. I am a coffee drinker. But it's just,
Dr. Ellis, we got a lot of people who aren't necessarily just from the Virgin Islands and are familiar with you. If you could just give a little bit of your background.
Yeah, so I'm an epidemiologist by training. I actually did an epidemic intelligence service fellowship with the Centers for Disease Control, and have worked mostly in emerging infectious diseases throughout my career. I worked in Singapore on Zika, chikungunya, dengue. So specialized really in the mosquito-borne and infectious diseases. And I've been here in the Virgin Islands as the territorial epidemiologist for 7 years now. And my son was born here, so he's Crucian. I live on St. Croix, but serve the territory. And, I guess we were really fortunate in that we are a small community. And when I first came here, it was an epidemiologist of one. But through capacity building over the years, we now have a staff of 14. And part of that was actually in response to the hurricane. We had some cases of leptospirosis, which is spread by rat urine and is common after flooding events. We had some cases of melioidosis, which you can get from soil, contaminated soil. Burkholderia pseudomallei is the bacteria that spreads it. So we were able to hire staff, and it was critical to our response because all of those staff over the past 3 years have been trained in how to conduct surveillance, run reports, do analyses, conduct contact tracing in regards to other infectious diseases. So when this happened, there was no delay. And we really, I just, want to thank the Department of Health, all of the staff, because not just the epi staff, but communicable disease, the nurses, everybody really came together to volunteer and run the hotline. But we've been working since January to prevent as many cases as possible and ultimately to prevent deaths. And that's been very successful. The contact tracing has been very successful because we are a small community, and people are forthcoming of this is where I've been, this is who I came into contact with, and we could quickly contact those people, quarantine them, test them as needed. We're also able to provide any resources that are needed to those that have to quarantine, because you might quickly find out you have to quarantine and you don't have groceries to quarantine for 14 days. If you just, if you think of where you are sitting right now and all of a sudden you got a call and said you have to quarantine for 14 days, you probably don't have everything you need, or 10 to 13 days. So the criteria we're using.
You don't know my husband. He's got like an extra freezer with. I feel like sometimes I married my father. You don't think you're going to marry a person like your parent, but you do. And my husband has like fish and conch and steaks and pork. It's crazy the amount of we could last for a month.
But Health and Human Services has helped out my brother's table and a lot of different agencies to provide food to those that need it. We'll drop off food to people's houses. And also provide mental health support services, and because it's quite challenging too, the mental health aspects, especially if you're positive in your home and you live with others. We have hotels that we've partnered with that we can move people into to quarantine as needed. So it's been a really comprehensive, successful response. And back, I would say 2 months ago, we essentially completely stopped transmission. We had over 2 weeks of 0 cases, and now we've had a couple of cases trickle in. We're continuing to re-implement all of our original mitigation strategies that did work well and continue those efforts. And face coverings are a big part of that.
So I see a question that came here. Someone wants to know, can you give us a better understanding of the precautions that are in place from points of entry? So starting when a visitor leaves their departure gate and comes into the territory, and from there.
Well, we have one individual who actually touched bases with all of the port of entries. You want to have that one person who knows what all's going on with linking to other people within the Department of Health. So Mr. Obed Williams actually is our lead person for that. And he works, and also I have to say that the Lieutenant Governor has taken a special interest in that area as well. And so he, as well as Attorney Bourne, has worked with Tourism Commissioner Bushelty, also has been very engaged. So he's there working with the airlines, ensuring that we know exactly who's coming in. I mean, how many people are coming in, when they're coming in. It allows us to better to prepare. Virgin Islands National Guard has linked with us, so they're the ones who's actually at the airports, and we're working on the seaports as well. So we have their own individuals, their own staff members working and educating individuals at the seaports, at the airports. We're taking temperatures, we're completing surveys. We haven't seen anyone that has come through thus far with a highly suspect case that we've had to track. We have had a tremendous response from the community. The ones that have come to us and said that they've been having symptoms and they've been tested positive, they've actually called the hotline. So one of the key things is to let everyone know those two hotline numbers, 340-712-6299 and 340-776-1519.
Okay, can you give those again a little slower so
Yes.
Shapira can put them on the screen?
Sure, 340-712-6299 and 340-776-1519. It doesn't matter which island you're on, you could call either or. Yesterday, I have to tell you, we were bombarded. We got a tremendous amount of calls. Actually, I could tell you on the hotline because, of the second community acquired transmission that we got. So what happened is we actually had to send individuals from different divisions to take hotline calls. They've already been trained, so that was actually very easy for them. And so that's one of the things that we're doing. And people are calling. Our numbers were down last week. I think one day we were only testing 4 individuals. We're back up to where we're testing 20 today. We may have more tomorrow, but I have to tell you that we also have now put quick tests in 3 areas. Both hospitals have had the Abbott the quick test for several months now. It's now added to Myra Keaton and St. John. So whoever needs, and we're testing everyone. We're not just that come and say, okay, we have symptoms. We're encouraging everyone, if you're concerned, please, this is where, call this number and we will test you. I want to touch bases on something that Dr. Ellis spoke of, and that is the behavioral health aspect of this. We are willing, and calling that hotline number would allow you also to link with behavioral health services. And so our Division of Behavioral Health and Alcohol and Drug Dependence are very prepped and poised, not just to provide behavioral health to the community, but we're prepped and poised to provide behavioral health counseling to the staff and the different agencies, private and public, because they're also impacted. It's not just the community. We're working every day. We're living in it. And I think Dr. Peterson spoke about that. As healthcare providers, we have had healthcare providers within the territory who have become positive. And what we did is that we tried to intervene by ensuring that the hospitals had the number of staff that allowed the staff that was ill not to have to even think about being present. So we're also working closely with them. It's a truly collaborative.
Good morning, Renee Peterson and Jason. Thank you for that question. But now I want to understand. So if we have community transmission that's from travel related, I guess, someone who comes into the territory, those individuals when they had the temperature done, they were fine, and I guess they developed symptoms later on.
Correct.
And then, so what happens to that person? They develop the symptoms and they call the hotline. I guess that's what happens.
Yes, correct.
And then you all take some intake from them as to who all that they've been in contact with.
Well, the first thing that happens is we let them know that, yes, Dr. S, you want to take this because I've been speaking and you're here, so I want to share this one with you.
Yeah, sure. So, the first thing that happens is they call and they aren't feeling well. They're given instruction about what they need to do, and most importantly, quarantine themselves away from others, because at that moment they become a person under investigation. And as soon as you become a person under investigation, until you receive a negative result or you are told you can come out of quarantine, you are required to quarantine. And then they're given instruction to come. We have some drive-through testing sites. They come to the drive-through testing site. We swab the individuals in the car, and then they drive home and go back to quarantine if depending on the circumstance, or we move them to another site if needed safely. But then also we have individuals that might not be able to drive to the drive-through. So for those, we set up a home visit, and we'll show up and we'll test the person on site. And then we'll call them later with the results to say you're negative, but you still need to quarantine because you had close contact with the confirmed case. So that would be like a household member or a spouse. If you're a spouse of a confirmed case, or a close family member, or you're a caregiver for a confirmed case, you still have to quarantine for the entire time period, even if you get a negative, because we have to remember, and that's why we continue to do the education, that there's a 14-day incubation period. So, your husband might have tested positive, and you get tested on day 2 of his positive, but you still have the potential to seroconvert or become positive for 14 days. So I think the quarantine aspect.
And I want to read something that Dr. Peterson actually is still giving advice.
I was going to say if Dr. Peterson can come on. What were you saying?
Yeah, no, look, this is the argument right here for why we all need to wear masks, because this is what we're dealing with, where everyone seems to think, well, I don't need to wear one, but you need, because if actually everyone, see, this is not a me phenomenon. This is a we're in this together kind of phenomenon. So if we're all wearing masks and everyone is washing hands, even if someone came off the plane and later was infected, the risk of them having given it to someone else while other people are wearing masks greatly reduces that risk. Everything that Dr. Ellis and Commissioner Convalescent is saying is absolutely perfect and is accurate. But what they need more than anything else is for the community and all of us to band together and do our part. Because if we're doing our part, then their job becomes very easy.
So Tom, you've been quiet all this time, which I know is difficult for you. You have, you've been through this, and that's giving you a perspective that's really different than most of us. And you're hearing what Dr. Peterson was saying. What are your thoughts? I mean, tell us a little bit about what happened with you and what you've done.
Sure. My name's Con Davis. I'm from St. Thomas also, and I'm an investment banker by training and work in finance. And I kind of go between St. Thomas and New York, depending upon the year and what's going on. In mid-February, I was actually in Milan for the outbreak. There was no outbreak when I got there, but I was there with a client who's got a large production company. And I was there for 4 days, just kind of work-related stuff, dinners, events, and whatnot. Events with anywhere from 20 people to 5,000 people. Milan is kind of for Fashion Week, it's the big, it's like our carnival, it's the biggest thing of the year. And I think when epidemiologists go back and study, what they're going to find is that the initial outbreak obviously was in Wuhan. There's a shoe factory outside of Milan in the Lombardy region. There was a soccer game, and then there was Milan Fashion Week. And from Milan Fashion Week, it exploded to everywhere in the world because you had people at that event from everywhere in the world. So I went over there coincidentally. I already had a cold. I had a chest virus. I had a rhinoenterovirus, which is something I found out after the fact, obviously. But I just had a little bit of a sniffle. So when I got there, it was kind of business as usual. And then when I was on Saturday night, they had the first few cases, but that was 30 minutes outside of Milan. Sunday we laid low. Monday I flew out. And at that point, I got in Monday night and there were 50 cases. So it started to become a bit more real for me personally and for the people of Italy. And, luckily I made the decision to quarantine. There was I don't even want to get into the messaging in New York City regarding this or, otherwise, but there was very, very low awareness. I was expecting to be greeted with, thermometers and everything when I got off my A380 Emirates big plane with 550 passengers. Nothing of the sort. You walk straight in.
Like what, the beginning of March or something? So
this was February 25th. I was there 20th to the 24th, 25th. So I got in and I traveled with about 5 or 6 people, different nationalities, some green card holders, a pretty mixed group. And we all laughed because we said it was the fastest we'd ever been through customs at JFK, you know. And then the next morning, this kind of started to spiral out of control. The numbers started to skyrocket to 50, 60 or whatnot. So I stayed home, and luckily I did, because I could have become more famous as the guy that got the whole New York Stock Exchange sick, because my investment bank is a small boutique firm, and I work with a number of different clients. I was there with a hospitality client. I sit on the board of a healthcare company that just got a $1 million NIH grant, which is the only good news I've had in about 4 months. And I helped my mother with her business, which is the largest medical lab in the Virgin Islands, called Community Medical Lab, which we've had for 24 years. So I'm in no way a medical expert. I'm a finance guy, but I know enough to be dangerous. So I got back, and it started to spiral out of control. Now, our banking division is separate from our floor business for regulatory purposes, but we're the largest broker on the floor of the New York Stock Exchange. So luckily I didn't go into work, because I could have got people sick, and I could have got more people sick, and we could have got the whole floor of the New York Stock Exchange sick. And I stayed home, and that kind of began my quarantine. So a week into my quarantine, I felt fine. I was, working out by myself in my gym, no issues, just the same kind of cold. About 9 days after I got back, I got news that my friend Joey, who's also 36, was in a coma in Brooklyn. He was the man in Brooklyn that was in a coma. The mayor said that he had diabetes, which is not true. He does not have diabetes. And there was all of this misinformation being spread that this is just an elderly disease, and et cetera, et cetera, et cetera. And ultimately, that's what forced me to get tested. And at that juncture, I literally had to force them to test me when I went to urgent care. They didn't want to test me. And I said, my friend's in a coma. He's got COVID. I've got some symptoms. I need to get tested. And they didn't want to test me. Then they tested me. And I came back positive 5 days later. And I, luckily had been self-quarantining. And then about another 5 days after that, my chest started to hurt. I had problems breathing, and I went to the ER, and that was my first time in the ER. They discovered I had pneumonia in both my lungs. And I'm a free diver. I'm a spear fisherman, so I go between St. Thomas and St. Croix offshore, diving deep, and doing all that sort of stuff since I was 5 years old. So luckily for that, because my lungs are 20 to 25% bigger, according to the doctors that I spent so much time with. And that kept me from not allowing my oxygen levels to get below 96. But my heart rate was resting between 100 and 180 for 6 weeks. So now they're saying there's a lot more issues with pulmonary stuff and whatnot. It's a lot more complex than just pneumonia per se. And that was my feeling from the beginning, because that was just what my body was kind of feeling. So essentially, my heart had to work so hard because my lungs had been, compromised.
Right.
So that was the first time that I went in, and they basically told me, they greeted me like in hazmat suits. I was number 50 in New York. My buddy was number 10 in the entire city. So it's like winning the reverse lottery, I guess. So I went in that time. They basically put me in my own. And, got lung problems, you're okay, you're stable, go home, and if you can't breathe, come back. That's all you're going to get, in terms of, I got an antibiotic drip because of pneumonia. There's not a lot that they're going to be able to do for you, frankly, if you're having a trouble. Your body just has to beat it. I think there's more cocktails being tried now. I actually took hydroxychloroquine. I'll go into that in a minute, but so that was the first time that I went in, and then effectively, every 10 days, 7 to 10 days, I ended up back in the ER. By the last time,
how long did you go through that, going back to the
so I tested positive for a long time. And again, the whole system is a bit screwy between the hospital systems in New York. I was in New York Presbyterian, which was excellent. And then after I got out, I went to quarantine upstate on my parents' farm by myself. So I didn't break quarantine. I just got in my car and left. Because I was concerned with the hospital system being overrun in New York, to be quite honest, not being able to get a respirator. And they told me I didn't need one. So the second time I was in the hospital was actually in Albany. So I went and I was by myself for 6 weeks. So I tested positive for 30 days. I was by myself for about 6 weeks, which is, it's an interesting story in itself, just being by yourself for 6 weeks. But the second time I went to the hospital, same thing. I was having a hard time breathing, but I'm up there. I'm 40 minutes from the hospital, which was kind of the risk I had to weigh of going up there. So I drove there, and I was kind of having real problems. And I got to the hospital, and excellent treatment, same kind of thing. One day and one night in the ER, back out. And then the fourth time I went in, it was basically, I think, a panic-induced issue, because my heart rate was already very, very high. I'd been tested, and I was trying to test negative so that I could get my antibodies to my dad's best friend, who's struggling. And then he passed away. And then when that happened, I went back to the hospital. So, after that, waited another 2 weeks, and then I tested negative, and that was almost 3 months ago. And it's a very, very slow recovery if you have a serious case. I mean, I couldn't walk up the hill here, and that was 3 weeks after I tested negative when I came back to St. Thomas. Tested again, and antibodies and the rest of it. But I couldn't even walk up the hill, for a month. And then it got a little bit better. And now I'm like 90%. My heart rate's still, elevated. And then there's other, stresses with life and work and the rest of it. It's back to normal, but it's not. So, it's an interesting time, that's for sure. I'm sure there are positive things that are going to come from it. I learned a lot, and I don't view it as a negative experience, other than some people being lost. But for me, it was a good learning experience.
So I was going to bring Dr. Ellis and Dr. Peterson with you, Con, because I think some of the things you're saying and what you went through. So Con, you were at the beginning of this, when there were so many unknowns, misinformation. People were just talking about it being on the West Coast. I remember Congress was still in session, first week of March. We were having briefings, and all the members from Washington State and California were flipping out. And the members, from the South and the East were kind of like, that's.
And you can still see that to a degree.
Right.
And the red states aren't taking it as seriously.
Right. And then many of us members who had majority minority communities were like, seems to be affecting white people, not Black people, because that was another piece of misinformation that was out there. But Dr. Ellis and Dr. Peterson, some of the things that Con were talking about, I thought you guys might want to chime in about, his treatment. We're talking about plasma, and I know Dr. Peterson, you're saying how helpful that's been in New York, the antibody plasmas and things that we know now. What are your thoughts about that?
Well, clearly you're right. There was so much misinformation on what treatments were out there. When I got sick, it was recommended I take hydroxychloroquine also, and I refused to do that because there were no clinical trials to suggest taking something like that, particularly with the side effects. For those of us who have done work, probably Dr. Ellis herself, in the areas that she's worked in, and myself in Africa and the places I've been to, you didn't even want to take it to protect yourself from malaria, let alone to take it in the midst of how we should actually treat this. I think for myself, the things that we've seen most, perhaps that there's going to be benefit to it, but we'll have to wait and see once we look at the numbers, is convalescent plasma, which is plasma that you transfuse to patients from people who already had and recovered from the coronavirus. And there is hope that remdesivir will also show will make a difference in the patients who have been affected with the coronavirus. I gave my plasma as well because I've been tested positive for the antibodies and I recovered from the illness. So, we're asking for people who have recovered and perhaps have antibodies to give plasma, because that will be beneficial in the long run, we believe.
Dr. Ellis, were you going to add something?
Yeah, well, there was so much that you were saying, Con, that I'd love to dissect, but I'll just focus on one piece of that, and that was the diagnostic testing, because I think there's a lot of confusion kind of about some of the diagnostic testing. PCR, which tests for the actual presence of the virus, versus antibody testing. Is it IgM antibody or IgG antibody? And IgM antibody is the one that's first on the scene after you've recovered from the virus, and then the IgG antibody is hopefully present for life and may provide some sort of immunity, but we just don't know. But the PCR test, which tests for the actual presence of the virus, is just so good that it can actually detect pieces of the virus, and you're not necessarily contagious. So we've had quite a few people, not just in the Virgin Islands, but nationally and internationally, that will test PCR positive for a month or 2 months. But it's called viral litter or viral shedding, and it's really just pieces of the virus, and you're not necessarily contagious. So it's great that, I mean, yours was early on, so you're obviously very conservative to make sure that you're not passing it to anyone. But I know I saw Ms. Herrera's question about if you quarantine, after you quarantine, do we test again? So we don't test again anymore, because even if you test positive, that doesn't necessarily mean you're contagious, and studies have shown that you can't actually culture the virus after a certain period of time, and that time is 10 days after your first symptom onset and 3 days after fever recovery, whichever is longer. And so here we're actually doing 14 days after symptom onset and 3 days post fever recovery, whichever is longer, just to be a little bit more conservative. But we're not doing negative test rule-outs.
Yeah, and that's how.
So when someone, just a quick question. So Dr. Ellis, when someone calls a hotline, what kind of test are they going to get?
A PCR test, definitely a PCR test, because someone.
That's the no one.
And that's the test for the actual presence of the virus. Yes.
And that's really for those, I mean, that's more important now for those patients who are symptomatic.
Right.
I mean, we're moving into the phase now where I think most people are more interested in whether or not you have the antibodies, because that's what's going to tell us how much of our society we can open up. Because we believe that if we have enough people walking around with antibodies, things will start to get a little bit sick. We don't know. There's a lot that we still don't know, but we believe that there might be some benefit to having antibodies and being able to say, well, these workers could go back still wearing masks, but maybe these people can go back to work. You know, these people should still, you know, take different precautions and stuff like that.
Right. Congresswoman, yeah, I wanted to let the individuals from the VI know that we actually have access to antibody testing. We have agencies who have actually come to us and want to continue. So Dr. Ellis and I have started that conversation as to when we actually do widespread antibody testing, and that's coming up shortly. And also to let the general public know that we have remdesivir, as well have started in one person on the plasma treatment. And so we're also going that, and we're teaching all hospitals how to implement the proning process if we have a patient that is requiring intubation in the ICU. So we've actually done that whole gamut. It's not just education training, but providing the staff. So we've linked also with private companies and volunteer companies to bring staff down, if God forbid that we have the numbers that we need to care for. So we're working around the gamut.
And Commissioner, I want to say something about the whole proning thing, because just so that people who don't understand what that is, proning is mostly when patients are in the hospital, they're on their back. And proning is you put the patients onto their stomach so that you could open up the airways on the posterior aspect of the body to increase oxygenation, because these patients, well, we initially thought that their lungs were not compliant, meaning the lungs wouldn't move with the ventilator. The lungs are actually moving. We just can't get oxygen to move through. So we need all the air spaces to open up. But the reason I wanted to bring this up, because at home, one of the things I did with my own mother, and people can do this at home, was I would put my mother in a chair and bend her over. And then I would do chest PT by cupping on the back of her chest. And that was my home version of proning, to open up her airways on the back. So even at home, people can learn, we can teach people in the to do that chest PT cupping on the back to try and open up those airways as well. But that's a good point of proning.
Con, it's interesting to me that you talk that you were such a healthy person, very, eat well, exercise tremendously, and you are still, not at full capacity much later. Are you have you spoken with doctors? Do the docs know? Has there been discussion about, the after effects of how to bring people 100 back to 100? And are you seeing doctors regularly to ensure that?
To tell you the truth, I mean, what I've learned through this entire experience, and what I was going to add to what Dr. Ellis said, was that now that's what the CDC protocol is. But just in that 1 month that I was sick, everything changed so much. So there's a lot more known now than there was, and the protocols have changed. When I first went in, we were like the first handful of people in New York. So the Department of Health was going to be in New York, was going to be calling me daily and visiting me twice a week. I still haven't gotten a call from the Department of Health in New York, and they had all my information. So I don't know what happened there, nor did my buddy. But this all changed, and the yardsticks moved a lot, And I love science. I believe in science heavily, but there's just what I've learned throughout this whole thing personally is that there's a lot more that we don't know in some regards than we do know. And an ounce of prevention is worth a lot more than a pound of cure in these regards. So it's like from an educational perspective, whatever you can do, I tell people, whatever you can do not to get it, do whatever you can, because I just don't want people to be in that situation. I've lost 3 friends. I've seen what the doctors have to go through. We've done a lot to try to help them in New York with meals and whatnot. We raised some money and provided like 11,000 meals. My buddy did most of it, but it's one of those things you want to avoid. So what I've tried to do, frankly, because I was so much earlier in terms of getting sick and recovery, is just try to get back to normal. Try to rest when I can. I only slept 3 hours a day for 6 weeks. I couldn't sleep. So now I sleep 5-7 hours a night usually. But I want to try to give the medical industry some time to really get up to speed on what's going on with these patients, because the after effects, I'm so early that there isn't, I don't know who the specialist that I would go to, right? So I've got friends, I've got access to great doctors, but they've seen a number of people that are recovering, and there's data, and they're working through it. So I've been trying to wait 2 months to go back and get checked out and really assess who I want to go to.
Congresswoman, I just want to say that there's a reason it's called novel coronavirus, because it's novel. We absolutely know nothing about this virus. I mean, we talk a lot about the whole breathing stuff and people having difficulty breathing, but just we dealt with things that we've never seen before. All these young people who came in with strokes, who took forever to wake up. We were doing a much larger rate of amputations than we've ever seen before, because we were seeing large vessel occlusion of the femoral artery being occluded, the iliac artery being occluded, having to amputate.
Dr. Peterson, you got to speak English for us.
Yeah, so these are the major blood vessels that supply the blood supply to the legs. We were having to amputate legs, amputate feet. We were seeing things that we've never seen before. And then if you just look at what happened with the pediatric population in New York, where we started to see this autoimmune disease, I think the point here is we don't know what the long-term effects, even for those of us that had it recovered, okay, great, we have antibodies. I don't know if a year from now I'm going to find out that this has long-term effects on my kidneys, my heart. We don't know. And this is why it frustrates me when I hear everyone having their opinions about whether they need to wear a mask or they don't need a mask, or they seem to know which masks work better. Well, I'm glad maybe you should tell the experts, because we don't know. It's the novel coronavirus, meaning it's new. We're just learning about this illness, and we all have, I'm going to keep saying this, we're in this together. Everybody has to follow the recommendations of epidemiologists like Dr. Ellis and the CDC, because we're all in it together and we're going to figure this thing out. None of us have the answers for any of it.
Well, Dr. Peterson, you know my daughter very well. She's
Yes.
kind of close to your birth date also.
Yeah.
And, you know, whatever. The multiple personalities of Gemini's rule. But when you say we're all in this together, you know, I traveled between DC and the Virgin Islands, and I've been trying to like limit it. Okay, I'm going to stay home on St. Croix for 6 weeks. Then I'll go back, you know, and I'll be up in DC for 3 weeks, then go back, you know, like trying not to be on that plane back and forth. But when I came home the first time, Talia met me at the door. You know, it's like 11 o'clock when I get in, and she's like, the basement. You could sleep in the basement because we're all in this together, and you need to quarantine yourself. I was like, are you, you know, you're tripping. But we all need to, you know, I see in the Virgin Islands, I'm concerned because I feel that we've done such a good job that we think we're past it. And people want to start hugging again. People, you know, they don't want to wear a mask when they're with their friends because, like, one of my staff said to me, people think social isolation is with your social circle, not with the people in your house. Can you talk, Dr. Ellis or Commissioner, are we in the first wave still? Are we done with the first wave? Are we in the second wave? What is the CDC? What do you all think at this point?
Dr. Ellis?
Yeah, I can take a first shot at that. And original models that we ran to project that data, this mathematical model, try to project when our outbreak was going to peak based on how many people are getting infected, where they are they travelers, are they close contacts, are they community-acquired cases, did say that we would have peaked here in the Virgin Islands in early May. However, early intervention and the governor really putting in place the closing of hotels and Airbnbs essentially stopped travel, and the model crashed. Our case count just went like just straight down, which was wonderful. And a new model that we recently ran seems to predict that we may have already peaked. But it's math. It's not real life. And just seeing in the last week, we had 2 community-acquired cases, which means we just can't figure out where those people got it from. They weren't a close contact of a confirmed case. They weren't a traveler, and that's concerning. That really means there is more transmission out there that's going undetected, and there are people without symptoms at all that can spread the virus. And that's why it's so important, like Dr. Peterson said, wear a mask, wear a mask, wear a mask, wear a face covering everywhere, even in social gatherings, or, you know, I just don't know that now is the time to do social gatherings. Unfortunately, in the past, just this past week, 10 states had the most cases they've ever had in a single day. And one of those was Florida. They had the most cases they've had in a single day on Tuesday. And then on Thursday, they actually surpassed that number and had the most cases they've ever had. So I just think that we need to be incredibly diligent. And that's why we had a press briefing yesterday, too, to reiterate some of the mitigation measures that have been in place, but people are feeling a little bit more relaxed, like, oh, we're good because we haven't seen very many cases. Well, we haven't seen very many cases because we do so well to follow the guidance.
One of the things that we've done is actually I've deputized more individuals within our environmental health team. So many of our directors, our deputy commissioners, I actually went around on Thursday evening. And so we stopped at a place that we saw individuals not wearing masks. So these individuals are going out there enforcing VIPD. There's a task force that VIPD runs also, and they go out in groups. And it's really education. So our premise is you educate and then you regulate. Fines may be cited. However, before that, just really want to teach the public. And like Dr. Ellis said, we actually added a press conference yesterday for this reason. And Congressman, this invitation came so timely because this is the time for us to be able to get back out there and start. It's like I told someone, it's like starting back over again. You know, we were at 0 cases. Now we're starting to creep up, but this is a time when we really have to do the guidances are there. We just need to follow them. We're also working with the Department of Education and the governor's office to speak about school openings, what we're going to do. And so we have that task force. We're working directly with CDC. So we have a meeting just for the VI in reference to schools that we're going to address that issue on Monday with CDC for the second time. And then we're going to start to roll out our guidance, ensure, look at how each school is structured in a different way. So those are all the things that we're saying. It's Flash, it's a new norm, and we have to live within this new norm, but we have to live. So it's how we do it.
Well, I think, this has been a great conversation. There was a question about ventilators, but I do believe, Dr. Ellis, Commissioner, we have sufficient ventilators at this time, should we need it. We do, yes. And we have the beds if it comes to that, if it's needed at this point. You even have, I remember your briefing with me, that you have agreements with other docs should we need additional healthcare workers to come to the Virgin Islands. So the things that Dr. Peterson and Con went through, we've seen that. We've seen the best practices and what's worked and what's not worked, and are able to implement it in our own home, should, God forbid, that be the case, right?
Correct.
So I asked you guys, usually what I do is I also ask people to share a movie that they've been watching or a book. But because tomorrow is Father's Day, right before we came in, I asked you guys to be thinking about your own fathers and let you close on a reflection of fatherhood. So Dr. Ellis, you want to go first?
Thank you. Yeah, I'm almost like in tears. I'm so thankful for my father. Happy Father's Day, Dad. And he's this wonderful father. There's never
Commissioner Encarnacion, do you want to
so
share a reflection?
Yes, I have to tell you that when the pandemic started, I called my father and I said, okay, you want to come live with me? And he thought about it, and he's actually been living with me. And so I'm blessed to have my father here, not just in St. Croix, but actually living with me and my son. So Negro Luis Antonio Encarnacion, better known as Negro, happy Father's Day. I love you to the moon and back. Thank you for everything.
Con, do you have something you want to share?
Sure. So I'm in St. Thomas now, helping my mom with the family business, and my dad's actually in New York with my sister and my nephew. But I guess my dad taught me how to dive, and I always had a love for nature and the water, and it was just my hobby. I would work to dive and work to fish, basically, which is why I have a good tan at the moment, because any opportunity I get to go diving, I'll go, because the doctors told me it's what kept me off a respirator. So thanks, Dad.
Before you go, Dr. Peterson, someone is saying here, Paul Lockhart, I agree, mask, mask, mask. We need to help create the mindset that the mask helps and that it's the new normal. So thank you from a young Virgin Islander who is trying to pass on that message. Happy Father's Day to you, Juan Figueroa Serville, and happy Father's Day. Thank you, Randall James. Dr. Peterson, I see you've got one of my favorite people next to you.
There you are.
Love you so much, Miss Candia. How are you?
I'm good, and you?
I'm so good. It's so good to see your face. Miss you. I miss you so much. Bert he's been hogging you up in New York.
Yes.
Yes, and I want to stay here.
I know people have no clue Miss Candia runs Harlem when
that's
she's
right.
in that place.
That's right. Anyway, and then in terms of my father, I want to say that you know, when I spent a lot of time when I was growing up making sure everyone knew that I was that I was Bert Peterson Jr. and that I was distinct from my father, you know. And the thing that I've gotten to know, my father is no longer with me. He transitioned in January of 2006. But I'm very clear that my father lives within me. I am so much like my father, it's ridiculous, especially when it comes to Carnival, my love of the Democratic Party, my love of politics. You know, I am my father's son through and through. So on tomorrow, when I won't get to celebrate it with him, wherever he is, I just want him to know how much I love him and I appreciate everything that he instilled in me. And I am my father's son.
Mm. Wow, you guys have me tearing up a little bit there. People know I hate when I cry. You know, I always like, but thank you so much for being on the air with us. And thank you for sharing your stories and the information. Dr. Ellis, Commissioner Encarnacion, thank you for being on the front lines, for caring about your community, for being a part of it. Con, I want to thank you. You know, so many people are not sharing that they've been through this. The fact that you've been so open and so brave about what you have been through, we really want to big you up for that. And a special shout out went out to you, Con, and to Dr. Peterson from Kaiser Callwood in my office, said that he's praying for you too, loves you guys, and wants you to know that. So I guess this is
Kaiser
my time.
for Board of Elections.
Kaiser for Board of Education, yes. Oh, you being political on my show. We all got elections coming up here now. But listen, I guess it's my time to talk about my dad. I'm blessed that my father is still with us. My dad is 88. And it's funny because I was looking at someone's post about their father, and they were saying that they, you know, their father said that they love them. And, you know, from an older Caribbean man, that was, you know, people should know that's unusual. But I grew up in a house with Caribbean men who did show love constantly. You know, my dad and his brothers hugged each other, kissed each other, you know, had no problems changing diapers, but were manly men. You know, they, my dad, you know, and his brothers were very strong men, but their strength was also the fact that they were open about love as well. You know, I've seen my father cry. I know what his triggers are. To get him upset, they were willing to show their vulnerability as well. And the thing that I love most about my father is that in the I was born in the 60s. I'm 54 now. My father believed that there was equality in gender equality. I'm an only child, and he always taught me that I could do anything that anybody else could do. My father, you know, Con, you talk about your father teaching you how to dive and how to spearfish. My father took me out fishing and reveled in the fact that I caught more fish than the men's sons did. My father took me hunting. You know, one of my first gifts was a 30-06 hunting rifle from my father. And, you know, how to clean fish, how to curse, the appropriate way to curse, you know, how to make a perfect drink, but also how to be excellent in everything that you do. And, you know, I'm grateful for that. You know, my father's not perfect, and there were things that he did that, you know, we all are working through, their relationships with their spouses, relationships that they have that, you know, we as adults have to recognize what they brought to the table, their own experiences that created their shortfalls, their own upbringing that they had to work through. And so on this day of Father's Day, I just want to reflect on the men out there who are holding it down, both old and young. You know, I think about my husband, Jonathan. Want to wish him happy Father's Day as well. He came when we married. I had 4 sons, one of whom was very, very small, was only 3, and he took him in, and that is his son. And so grateful for the men who are doing what needs to be done. And I want to just raise a statistic in the Virgin Islands that we have proportionately more men who are single father households, head of households, than most other places in the United States. That there are men in the Virgin Islands who are taking care of their responsibility. And, I want to big those people up that are doing what needs to be done. Mothers have their Mother's Day. Let's have fathers have their Father's Day. And everyone, thank you all for being a part of this. Thanks for the great questions. Carol Burke, yes, happy Father's Day. Callie is resting in peace now. Want to thank him. Oh, Barbara Peterson. Barbara saying happy birthday. Her big brother, Bert, is on the show right now. Everyone have a great weekend, and thank you all for so much that you do, and talk to you soon. Thanks for coffee with Stacey.
Thank you.
Thank you.